Hi, I'm Mark Sweeney, owner and founder of Austin Dental Spa here in Austin, Texas. Let's talk about tooth grinding. How do you know, first of all, whether you're grinding your teeth or not? Well, the two main symptoms is, well, actually, most commonly, either your dentist tells you you're grinding your teeth or your spouse or someone else in the family tells you you're grinding your teeth because you're keeping them up at night. One of the other ways to tell is if you wake up in the morning with soreness in your jaw muscles or a mild headache that just won't go away first thing in the morning. That's probably a pretty good sign that you may be clenching or grinding your teeth. Those are two different things. Clenching, you're just squeezing in the same position all night long, and grinding, you're actually sliding them back and forth. They're both equally destructive, but with clenchers, they tend to break pieces of tooth off or split teeth in half. With grinding, you're just taking a tooth and wearing it down like rubbing it with sandpaper. If you throw in on top of that some acidity, if you've got acid reflux, then those people that grind their teeth and have reflux can really destroy their teeth in a fairly short period of time, less than 20 years. We've seen people come in here in their 40s and 50s and they've worn all the enamel off the surfaces of their teeth. Another thing that's come into play is sleep apnea, where I used to jokingly say, well, you can't grind your teeth and snore at the same time. And that is true that you can't do them both at the same time, but the same person can do both all night long. They've done more and more sleep studies in the past few years, and we've learned a lot about sleep apnea. People will stop breathing for up to 30, 45 seconds, and their oxygen concentration in their blood will drop down into the 70s when it's supposed to normally be between 95 and 100%. So not good for you health-wise. It can tax your heart and your lungs. And then these people would go through these apneic periods where they wouldn't breathe, and then they'd take a deep breath and snore some, and then start grinding their teeth. And so there are these phases they go through at night. We as dentists are trained to see the damage that's done when somebody comes in for a cleaning or an examination. We can tell if there's no points on their teeth and they've worn their teeth down flat. There's some kind of grinding going on at some time during the day or night. Some people do grind their teeth during the day, but most people do it at night. It's called Nocturnal Bruxism. That's the fancy term, but really it means grinding your teeth at night. So what do you do about it? Well, there's a couple of different ways to deal with that. The first and quickest thing and cheapest and easiest thing to do is make a night guard, which is a clear piece of plastic. They come in various shapes and sizes to address different issues, but basically it's a flat piece of plastic that gets put usually on your upper teeth so that at night when you're grinding, you're going to slide on that plastic and you're going to destroy that plastic over time, but you're not causing any damage to your teeth. So that's the simplest, easiest way to deal with it. Basically, you're putting an ice rink in there instead of an obstacle course, and the teeth aren't making contact against each other, so the plastic can be replaced easily and inexpensively, whereas your tooth structure cannot. There are various other treatments that can be done. Physical therapists work with people's jaws quite a bit. We have a system called TrueDenta that treats the jaws and treats not only TMJ symptoms, which come from people that clench or grind at night on a regular basis and on a consistent basis, and it relaxes the muscles in the facial area. Botox can be used to inject into the muscles here, which is common, but the problem with Botox is it only lasts about 3 months and then you're right back to where you started from. It kind of gets expensive after a while, but if you're in severe pain, it is one modality that can be used. With what we've all been through in the last year with the COVID pandemic and all things being shut down, they did a study, the American Dental Association did a study in August that the results came out in September of 2020, showing that of 1,500 dental offices that the American Dental Association studied back in August of 2020, the results came out in September of 2020. Didn't surprise anybody in the dental industry. There was a 46% increase across 1,500 dental offices reporting symptoms of people coming in with teeth grinding or broken teeth. because people were under a lot more stress, people were stuck at home, people were worried about getting sick and dying, and so all of those things contribute. Stress is not the only reason people will grind their teeth. I have been practicing 42 years and I've realized there are some people that it's just in their DNA. Everybody in their family grinds their teeth. It's just they're natural born grinders. So it can be that as well. There are other factors. I've had plenty of people that I've looked at and said, well, you were grinding your teeth. They said, no, I used to, and I do have a night guard at home, but that was when I lived in Houston and I had to sit in traffic for an hour every day going to work and coming home from work, and I'd clench and grind my teeth. So there are all kinds of different aspects to that, but mainly it's either stress related or it's in your DNA. So either way, it can be treated, and it's important to treat it before too much damage is done. One of the more recent and fascinating events that it's in its infancy stages, but I've seen some early reports as they're studying vitamin D deficiency because of the COVID shutdown, because that's one of the things that they're thinking that might contribute to hospitalization and death in COVID is a low vitamin D deficiency. But they're also finding some recent studies that showed that vitamin D deficiency can also lead to people clenching and grinding their teeth. Early on that subject, we'll be getting more information on that as the coming year goes by, but there are researchers working on that as we speak. So I hope this has been helpful information, and come see me if you're a grinder.